So I'm going to talk about how to choose a thesis topic. And during this course of the lecture, I'll basically outline your chain of thoughts and the planning behind choosing a thesis topic. It's very important that you choose the right research topic and do it correctly because both the aspects are important. So, what exactly we mean by a good thesis topic? First and foremost, it has to be very interesting and it should be a good learning experience during the course of your thesis, uh, which courses it for about a year or so. You should be able to uh, hone a skill, for example, learn a new technique in surgery or a methodology in case of clinical issues or clinical problems, or learn some lab techniques which will be very useful in your course. And at the end of the thesis, you should be it should be productive in the sense that the result of the research should be of value, so that you can publish it, or it adds value to the existing knowledge. So, as I said, it has to be interesting. You're going to spend quite a amount of time and effort during this course of your thesis activity, and so it has to be very interesting. It should motivate you to work well, and if you choose the right interesting topic for yourself, it will be good. So narrowing it down further, after that you have found a interesting topic, you should place the topic as per your career goals. So if you want to have a academic career, you can choose a very academic, research oriented topic, and you can reproduce it as a good publication at the end of the thesis. And if you are in a surgical field, then it is good to have a thesis topic which involves a surgical procedure or procedures. If you are in a clinical side, then you can choose a topic which involves a proper course of management or diagnosis. In laboratory settings, you can use topics which involves new tests, new skills in lab technology. And if you have a career option in your mind of going into super specialization, choose a topic which involves the super specialty of your choice, and you can use this as a springboard to the next career option. So then after this, you need to be very pragmatic. Use a topic which is where the knowledge is already there. Don't go into an absolutely untrodden path. Go in the field where a reasonable amount of knowledge and expertise does exist. That's a very pragmatic way of choosing a topic. At the same time, you should be aware that if the existing infrastructures which is already available in the hospital can be utilized for this, it should be economically viable. Don't expect the hospital to buy a huge thing for you in a course of 1 year. Procurement in sector does have a lot of regulations, and that involves a lot of time and budget allocation. So don't be the choice of your topic should be such that it is economically viable, and you should always get it ratified by your supervisor at the very beginning. And it is because it's a time bound activity. It is better that you plan it such that you don't expect to do a very brand new innovations or absolutely unfit idea, so that you can finish it in 1 year. Again, the pragmatic approach is you should be able to judge that whatever patients or subjects you are taking, you have reasonable amount of such patients available in your outpatient and your inpatient admissions, so that you can study those cases in the requisite time of 1 year. The follow-up time should be very realistic. You have a 1 year time to write, 1.5 years time to write the thesis, and it has to be have a follow-up time not more than 3 months, so that you can do the study for about 9 months, and the last patient recruited at ninth month, and then you can follow for 3 months. And divide your work accordingly also, because analysis time and work time. A very thumb rule is very simple thumb rule is 2/3 time is work and 1/3 is analysis. And it is better that you include the statistician who will do your data analysis in the beginning, so that you don't lose much time in analysis at the end of the study. Start thinking about the topic in a very wide canvas. If it is, say, for example, it's gallbladder. If you think about gallbladder, then narrow it down to the pathology of gallbladder, then the surgical problem of gallbladder. You just have to narrow it down from a broad subject. And thesis topic is basically a relatively narrow area of interest that can be thoroughly researched and discussed. Now, we basically present the thesis topic as a research question. The research question is basically a statement of the problem as a question. So I'll give you some examples. Is osteoporosis more common in patients with rheumatoid arthritis? Are abortions more frequent in patients with SLE? Do smokers have anterior wall MI more often than non-smokers? So these are the research. These are examples for research question, which has to be followed by a research hypothesis. Research hypothesis is basically an intelligent guess based on observations. It predicts likely answer to the research question. As I said, likely, an intelligent guess. It obviously means that the probable result you are going to present as an hypothesis is not gospel truth. It can change, but it is basically a kind of a likely outcome which you are predicting. So if you have a research question, that is osteoporosis more common in cases of rheumatoid arthritis compared to general population, the research hypothesis will be osteoporosis is more common in patients with rheumatoid arthritis compared to general population. Now, how do we get these research questions? First and foremost is clinical observation. Your supervisors, your senior colleagues have seen number of such cases in their clinical experience, and they have found some kind of correlation between different factors. So, clinical observation of your seniors and supervisors and co-supervisor is the source of research question. At the same time, published literature is also a source of research question. So, when you are looking for a thesis topic, do a thorough literature survey, literature search, to find out such queries in the literature. Then discuss those queries with your supervisor and correlate such issues with the supervisor's clinical observation. And then you will come to a research topic which you could frame as a research question. Now, how to value add a research hypothesis or a research question? It has to be specific. As I said, osteoporosis common in cases of rheumatoid arthritis? So both the things are very specific. Osteoporosis is a very specific disease entity. Rheumatoid arthritis is also. Now uh, it has to be quantified. So if you have to have osteoporosis, it has to be quantified by an investigation. It has to be again specific. Rheumatoid arthritis has to be uh, diagnosed by a specific clinical or a algorithmic parameter. The outcome has to be quantifiable. It cannot be vague. So this is an example where bone mineral density as defined by DEXA is lower in patients with newly diagnosed rheumatoid arthritis as compared to age and sex matched healthy controls. So initially, if we see the research question was slightly vague. Why? Because we said that Is osteoporosis more common in cases of rheumatoid arthritis? What was not specified? It was not specified as how you are diagnosing osteoporosis. So here now it is specified that bone mineral density as defined by DEXA is the specific for osteoporosis. Is lower in patients with newly diagnosed rheumatoid arthritis as per ACR 2010 criteria. So now you are specifying for rheumatoid arthritis as newly diagnosed and as per a particular criteria. At the same time, you are specifying the groups in which you will be studying this comparison. It has to be in compared in age and sex matched healthy controls. So everything has been specified. So this is a good hypothesis and a good research question. So in this case, the research question will be: is bone mineral density as defined by DEXA is lower in patients with newly diagnosed rheumatoid arthritis as per ACR 2010 criteria compared to age and sex matched healthy controls? Again, I'm coming back to the pragmatic part of it. Feasibility. You have to have a feasibility check. Are patients available in the OPD in adequate number as per the sample size requirement? If you have any lab test or radiological investigation, are the equipments there? Reagents are coming regularly. If they are not coming, then can they be procured easily? The equipments are there. The equipments are functioning. There is possibility of doing such number of cases in those equipments. Funds are available. Our funds are available to buy new reagents or equipment. Skilled manpower is present or not to perform those uh, activities like tests or surgery or whatever. And time. How much time will it take to study the patients and follow them up? So this is a kind of a checklist before you start your choose your thesis topic. You can use this as a checklist. Now, you may not be able to do a study alone. In that, you may not be able to do this study only with the help of your parent department. You might need collaborations. You might need collaborations if it is a multidisciplinary approach to management or diagnosis. You might need investigating support, and for that, you might need radio diagnosis or lab medicine. You might need people from super specialty or subspecialty departments if you have any thesis topic which involves super specialty as per your career option. So it is important to include such collaborating departments from the beginning. So you can talk to your supervisor, said that you will need a collaborating department, and let the supervisor decide whom to contact as a co-supervisor. And it is very important to define the responsibility of the supervisor and the co-supervisor in the course of the study. A statistician is also a very important collaborator who will be collaborating with all the theses in all departments, and a statistician should be consultant in the beginning, starting from the sample size calculation to the last analysis points. Now, after you have chosen the thesis topic as per the thought process I just outlined, there is a post test also. The post test for the thesis topic you have chosen, you have to ask certain questions to yourself. So, this topic falls in which area? How this topic or how this issue on which this thesis topic is based has developed or changed over time. If you see that breast reconstruction after cancer surgery, how this issue has changed over time. Initially, there used to be no reconstruction. Then there was delayed reconstruction. Then there was immediate reconstruction just in the same sitting after the mastectomy. Now came uh, silicone implants. Then came autologous. Then came again allografts. So these are the developments which has happened over time. So you have to see this chronology of event over happened over time, how the issue or the subject has developed over time. What are the major milestones in the development of the present concept? So these you have to dig out from the literature and the textbook. And out when you dig them out, you will find the disputed and the controversial question which are still hanging, and you have to fish them out. Those are the places where you will get your research question and your research topic. And another thing is find out the publications which are key publications by pioneers in the field. You must read those papers to find out how the pioneers in the subject have worked and how they have thought to change to bring out a paradigm shift in the knowledge. Now, after you have a fact check with yourself, you should have a fact check with your colleagues also. Present this idea to your colleagues and try to elicit response from them regarding the utility, interest, and relevance of the thesis topic from them. And I'm telling you, the candid responses from your colleagues will really help you to value add the topic. Peer review has always been a standard modality of choosing papers for publication. And you can use peer review for your thesis topic as well. You can ask your colleagues, so what test? They will ask you, so what? You're doing this, so what? So you can keep on answering their questions, and ultimately you will see that you have reached a place where the topic is really value added. You can design the study in hospital setting, in community setting, and it can be in hospital, it can be outpatient, it can be inpatient, community, it can be urban, rural, and it should be basically an observational, experimental, longitudinal, cross-sectional. These things will be again taken up by the next speakers. We generally avoid retrospective study. So what to avoid? Again, just recall what I said about pragmatic choosing of a thesis topic. You should always choose topics which involves patients in ample number. So don't choose rare diseases, and complex and invasive and expensive investigations should also be avoided, which are normally not for which normally infrastructure is not available in the hospital. Choose topics which involves surgeries which are being regularly performed in the department. Drugs trials are absolute no-no. It cannot be done during thesis. Long duration of follow-up. As I said, it should be practically done not more than 3 months of follow-up. Retrospective study cannot be done. And as I said, if you go back to my statement regarding research hypothesis, it was that I said research hypothesis is an interest. It is an intelligent guess on the likely outcome. So don't think about a conclusion. Think about a likely outcome in a hypothesis and try to build up your study around it. But don't build up your study on a prefixed conclusion. So you're bound to fail on that. So all said and done, it is the thesis topic you choose should not have been done in last 5 years in our university. So means the two colleges, our college and VMMC. It sometimes is helpful to find a old thesis which has been done just to have a idea about how to go about it, and you can always use those ideas and change the variables and do a new study. As I said, drug trials are not to be done, and this slide is basically just to complete the presentation.